Still getting it?
Not really.
Yeah, cool.
Yeah.
Look at this. This hip just keeps getting better. Okay. Hey, Ronan.
Hi.
How are you? Good to see you.
Good. How are you?
Good. Okay. So it's reassessment day. After our phase of treatments, I want to talk about what has changed and what has not changed so far. Okay. Now, I just want to make sure we're on the same page about this questionnaire. Level of progress since we started. You put a 5. That would indicate you feel 50% better. Is that accurate? Okay. Right on. Great.
Yep.
However, what we're even more concerned about though is why you did not circle here. Why you didn't circle resolved? What has not changed yet that we want to see changed?
Well, what hasn't changed is I still feel a little bit of the pain in my groin area and my hip.
Right, and that's changed more recently, the location, right?
Yes.
How has that changed?
It's moved over where crossing my leg hurts more than going the other way.
And we discovered that last visit, yeah.
Mm-hmm.
Do you remember the name of that muscle that we discovered is having problems with?
No.
No? Okay, just checking. Okay, and then the frequency, less frequent, more frequent?
Correct, less frequent.
Okay.
I feel like it's gotten a lot better and I'm not in as much excruciating pain because the pain seemed to be very intense when I was feeling the pain.
And more frequent.
So more frequent and more intense.
And now we talked about the times when it is a problem, is that almost like we're trying to cross your leg, not the actual putting it up or having it up there, but lifting it up there.
Correct.
When you engage that sartorius muscle.
Sartorius.
There you go. Yeah, sartorius.
Yep.
Sartorius,
so, yes.
BIG. So, yes.
So that hurt always, but it seems like now that the other is away, it's just focused more on this movement, like right there.
Awesome.
Where before it was even when I lifted it and went out, and it feels like it's gotten a lot stronger.
Okay, great. So what we're trying to emphasize now is not just getting these areas moving better, but strengthening better with your exercises. The ones that I've given you so far, how are those?
Good. I feel like those have helped a little bit too. I do them probably just once a day, but probably like 4 times a week.
Okay, all right.
So.
We could always do those a little bit more, especially anytime you're going to be active. Have you been doing more activities exercise-wise? Have you explored that?
I walk on the beach.
Perfect.
Basically, that's
and we
all
talked
I feel
about
like
that
I can do and feel comfortable
but we
without
want to get
overexerting it.
But we want to be able to, we want to get that hip so we can be able to do things like
CrossFit is my deal. I like CrossFit.
So we're trying to get to CrossFit, okay?
That's right, CrossFit.
All right. That's our goal.
It's a pretty intense workout, so I don't know if you want to hear about, that's why I think I'm injured, was from doing it
we go
intense.
back to the history, that we talked when you first came in, that's all the way back to history. It's hip history, hip replacement, overexertion of the exercise, and kind of almost back to where you
doing it too fast all at once with a new hip replacement. I think overexerted it.
Well, let's go out front and let's go assess your hip and get your spine adjusted, and then we'll talk about the next step, okay?
Sounds good.
All right, come on in. Let's have you lie on your back first today.
Okay.
So some of these things that we've improved on, we want to build a foundation on top of. So this is that sartorius test. Let's see where it's at today. Pull your foot up towards you. So remember, not kicking up. This is why your quad works well, but your body's afraid to use that sartorius. So pull your foot that way. Go ahead and hold that. Pull. Okay, and that one just doesn't want to lock out. And I can see the whole hip tries to stay short and bottled up, so you overuse your opposite side of your back, which is why your pelvis tends to misalign. So those are all compensations. Okay, drop this leg down. We're gonna dig right into that hip. Okay, let's compare sides here. See, from a tissue standpoint, I mean, that's feeling a lot better right there. When we go lower and more near the muscle belly, how's that feeling right there?
That doesn't, I feel it just like you're on the edge of it.
Okay. Catching right there at all?
Yep,
Say when?
right there.
Right there.
Yeah, right there.
Okay. So because you have had a hip replacement, some of our techniques are always more on the gentler side. I'm not saying it's easy to receive because we're still digging on some tough areas, but they're definitely on the gentler side. And we're going to decompress that hip joint as we internally rotate it, creating space. We're going to bring this out here. Just drop your hip. Good. We're just tractioning the capsule as we open it up.
Yeah, it's all in that area, that vicinity. You have it there.
And now we're going to externally rotate the hip, and you're going to push against me right here. And you're doing a good job with that. How's that feel?
It feels fine. That has no pain.
Awesome.
I think it used to have pain.
Oh yeah. Yeah. Okay, that same test. Still getting it?
Not really.
Yeah, cool.
Yeah.
Look at
it
this.
kinda
This
went
hip just
away.
keeps getting better.
I mean, maybe a little bit more on the outside
Lateral side.
of it this time.
Okay.
That I think it was a
Let's
little.
Let's get some nice gentle distractions here. Good.
That felt like you got a good spot.
Yeah, deep in the joint.
Yep.
Pull your tummy in. Squeeze your knees together. Squeeze hard. Oh, nice. Okay, go ahead and go face down. Let's check the pelvis alignment now. You come up a little bit higher. There you go. You feeling that one? Any hip? That's okay.
Yeah, no, I don't feel any pain.
Now I do feel it, so that's coming from somewhere. Go ahead and relax that ankle and let me feel that tone there. Getting better. So that's going to improve as we also improve the hip alignment there. And of course we're going to work out some of that mid-back pressure buildup from the work day.
There's plenty of that.
Okay, go ahead and lie on this side, please. Facing me right over here. There we go. Gotcha. Bring that over. And I'm gonna rest on that external hip musculature there, and you're gonna push your knee up against me. Good. Take a deep breath in and relax. Good. Okay, go ahead and lie on the other side. Now you traversed that table pretty smoothly, I must say. Doing a good job there.
It's you that does such a good job.
I was gonna say you weren't traversing that well on day one. Okay, just let that go. Good, already releasing. Excellent. Let's go ahead and have a seat at the bottom of the table. And cross your arms in front of you. There you go. And lie down. Drop your head back.
That felt good.
That was
Always.
fantastic. Okay, I want you to stand up and just march in place. There you go. Yep.
Oh yeah, it feels really good. Very, it feels flexible and
Loose hair?
yeah, very.
Okay.
Yeah.
Okay, go ahead and lie on your back. That's a good start. Let's see how strength-wise it's doing. Come all the way to the top.
Is that good?
Yeah, perfect. Okay, already just putting you in that position, you feel much more comfortable.
Oh, way better.
Pull your foot up towards you. Up, there's the quad compensation. So let's put right on that sartorius. So pull your foot that way. Okay, I feel you doing it this time. Hold, hold, hold. It's about 50% better, but that's far from perfect. So now let's talk about the next step. But hey, that was a great adjustment. Go ahead and sit up. Have a seat at the bottom. Yeah, that looks good. All right, but you ready to work on those exercises now?
Yep.
Okay, cool. All right. So